All right, Dr. Shapiro, can you tell us a bit about why you think physicians need support?
Well, first of all, thanks for asking about this. It's such an important aspect of our lives. What I would say is that one of the jobs of a peer supporter is to destigmatize and facilitate referrals for further support should the peer want them. Our culture has really supported the idea that we're supposed to bear whatever we're bearing on our own, that our needs pale in comparison to other groups. And that actually being vulnerable, especially emotionally, mentally, is weakness. And when, of course, we know actually it's strength. I had the privilege of being in different leadership positions, including being division chief when I was at Brigham and Women's Hospital, and also one of the leaders of graduate medical education for Mass General Brigham. And I just was seeing so much suffering on the part of people who were actually doing the work. And I really wanted to make a difference around that on a big scale, if possible, because I had the privilege of having a big view. And so that's what prompted me to say, we need to really focus on well-being and a culture that supports that in a big way. And so I pitched starting the Center for Professionalism and Peer Support in 2008.
So can you speak a little bit just to how the program works specifically, like how someone would go about receiving peer support in your model?
Ideally, it would be where there's been either an event or a known chronic stressor that whoever's running the peer support program, somebody would say, this happened, or this is happening to this group of people, or several people, physicians. And the head of the peer support program would then assign an individual peer supporter to either a group of people or one person. And so, let's say I was asked to provide you, Elizabeth, peer support. So I would, email you and just say, hey, I'm reaching out as a peer supporter. Give me a call when you get a chance. And then you probably would answer that because peer support, well, doesn't sound too bad, even if you're not 100% sure what it is. So you call me and I say, I don't know if you know this, but we have a peer support program and we reach out to anybody involved in whatever it was. And the reason we do this is because I and every colleague I know has been in situations like this, and some of us find it really helpful to actually talk to a colleague. Is that something you'd like to do? So that's an intervention in and of itself.
That makes a lot of sense to me. I got involved in this program myself because I was involved in an adverse event, and I received peer support from some of my colleagues where I was working at the time, and I found it was invaluable. It felt like they were really the only people that could actually understand. I remember when I was going through something, I did feel that I don't know if I would have reached out specifically for myself because of that culture of medicine we're in, that sense that you have that if there is a mistake made or something bad happens, it's a weakness and that you need to be silent about it. So I think people reaching out to me was a huge component of my ability to access support and then getting through that and learning so much from that experience.
Of course we care about each other. Like, that's who we are. We really care about each other as humans. And so this, having a peer support program, I think says that this organization cares about you. And so we have put this program into place and we're resourcing to keep it there. One of the things that I think, has to happen in all of our healthcare organizations is I really do believe that leaders have to be listening very closely to people who are on the front lines of this work to understand what it's like and what things the organization could be doing to decrease the things that are draining our well-being and to increase the things that are improving it. And listen to those concerns and that perspective and do something about it.